Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Zoey. She's a 6-year-old spayed female Yorkipoo who was referred to us because she has severe posterior paresis. As you can see, she has no voluntary control of either hind leg. She can still wag her tail, but she cannot urinate voluntarily, has no paniculus response, has no anal tone, so she's in real trouble here. So we are seeing this now, but it has been going on for several days. So we're several days into this dysfunction. The spinal cord doesn't show up on a survey radiograph, but we can see problems in the first lumbar vertebrae where the discs are calcified between L1, L2, L3, and the intervertebral spaces above the vertebrae seem to be obscured. So there's disc material where the spinal cord needs to reside, and the spinal cord is encased in bone and has nowhere to go. So thus the problem. It's like stepping on a garden hose where the nerve transmissions can no longer traverse through the spinal cord when it's compressed like this, and thus the dysfunction. My wife, Dr. Ann, is one of the few certified veterinary acupuncturists in the state, and here she is, effecting an acupuncture treatment, and now she is connecting the acupuncture needles to the acupunctoscope to put a small electric charge through them to potentiate their effect. Zoey receives many of these acupuncture treatments over a period of several days, and this is the first. We treat these patients with multimodal approach, which includes Western veterinary methods as well as acupuncture and class 4 therapeutic laser. So here's Zoey is wearing her goggles, and she's receiving one of many class 4 therapeutic laser treatments. Therapeutic laser uses light energy to impact the metabolism of cells, and it causes a reduction in inflammation, reduces swelling, reduces pain, and speeds healing. We also work with Zoey over and over and over to try to give her some confidence that she could use her hind legs again with physical therapy. This is one of many, many physical therapy sessions, and you can see that she has a long way to go. She can stand crouchingly for a second or two, cannot advance either one of her paws, and just eventually melts down to the table. So here's the next day. Zoey has received a variety of treatments, and we're again attempting the physical therapy and evaluating her response. And so she can support her weight a little bit, which is encouraging. That is progress, but has a long way to go. Cannot stand for more than for a few seconds and cannot advance either paw voluntarily. And here we are 2 days later from the last video and attempting the same thing. She's received multiple treatments therapeutic laser, acupuncture, and other treatment as well, and has improved some. She's standing better. She's more able to stand than she was before. She can stand for a longer period of time. She doesn't just melt to the floor, but still cannot advance either paw or begin to, and can barely stand. So here we are a few days later, repeating the same thing. It's now been a week she's been with us, and she's attempting to stand. She's working on it. She's trying. She wants to stand. She just needs the muscles in her hind legs to listen to her brain and receive those transmissions through her spinal cord to allow this to happen. And it is improving, albeit slowly. It is improving. These cases are not always linear. They don't always improve every day. They might plateau for a long time and then suddenly improve, or they might go the other direction. But Zoey seems to be improving slowly. She has a heart for it, and she's trying for sure. But she cannot will it to happen. It has to come as it comes. So we take Zoey outside to see how she might be able to do. A little better traction, a little more motivation, a little more distraction. So we'll see how she does outside. And there's not much difference at this point. So another of many therapeutic laser treatments. Here she is again with her goggles, and she tolerates this well. There's no pain or discomfort involved with this, and she seems to enjoy it. So her owner comes to visit, and she wants to run, but her hind legs just don't work as well as any of us hoped. So here, yet another acupuncture treatment, one of many during this time. So we take Zoey outside again. It's been over a week, and see if she can get better traction out here. She certainly wants to. So here we are the next day, and we're trying this again, and we can see the spirit is willing, but the flesh is weak, especially that right hind leg. It just not want to respond. The helm doesn't answer, and yet she can place it occasionally. We have hope. She is placing it somewhat at times. She is excited, and it doesn't work as quickly and as responsively as she wants it to, but she is gaining control slowly over this. So this is now a familiar scene, and you can see that she can support her weight much better than before, very consistently. She can stand at will for some length of time. So one more day, more treatment of all kinds, and now we're beginning to see a lot more progress. She's gained a lot of strength on both of her hind legs and some confidence as well. So Dr. Ann takes her out onto the sidewalk. She seems to do better on the concrete than she does in the grass even. And you can see she's doing quite well. And now this is another 6 days later. It's 2.5 weeks after Zoey came to us. Seemed pretty stark at the beginning, could not begin to stand or walk, had no control of her urinary bladder, no anal tone, and now all of that has come back and she's made a complete recovery. She can urinate voluntarily and she can control her defecation completely and has gained total control of both her hind legs completely normally. Took a lot of work, a lot of time. Zoey, you're a good girl. So now it's been 2 months since Zoey went home after her back injury, and she's come back to see us, and you can see she's doing extremely well. It was a long road back for Zoey. She had a lot of serious problems when she came in, not only unable to use her hind legs, could not place them at all or bear weight in any manner, but also no control of her urinary bladder. So it's truly a wonderful thing. She's made 100% recovery. She's dancing happily, frolicking, completely recovered. Her owner is certainly very pleased with her progress, and so all of us are very, very happy that all the hard work paid off. None of us gave up, and here we go. Happy day for Zoey. With a lot more happy days to come. Columbus Small Animal Hospital, loving our work.